Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Allison Warner. In this episode, sponsored by Ormco, I talk with Dr. Ricky Caples of Caples and Robinson Orthodontics, located in Monroe, Louisiana. With more than 3 decades in practice, Dr. Caples has seen the orthodontic specialty evolve from traditional twin brackets to the digital aligner-driven workflows shaping the industry today. He shares how clear aligners fit into his practice, why he made the move to spark clear aligners, and what that's meant for treatment efficiency and the patient experience. We also discuss his longtime experience with the Ultima bracket system and how having both solutions under Ormco's umbrella has streamlined care and support for his team and patients. Here's our conversation. Well, Dr. Caples, thank you so much for joining me. Really great to talk to you today.
It's an honor to be here. Thank you for having me.
Yeah, so to get started, can you tell our listeners about yourself and your practice, where it's located, your team, the type of patients you typically see?
You bet. So I'm in Monroe, Louisiana. I came here in 1993. I bought a practice from Dr. John Parker. I actually had 5 of the girls from 1993. They're just starting to retire, so I've been so lucky and blessed with a great staff. 26 ladies. I've got Dr. Chris Robinson that came into the practice in 2001.
Okay.
Amazing partner. And then recently, Dr. Cami Laird joined the practice about 2 years ago. She's been a great asset coming on board also. We're a 5-office practice. Main office is in Monroe. We have 3 or 4 satellites that we go to, and we do work 4 days a week, most weeks. Patient base is amazing. Most of our referrals are probably from the practice. Of course, we do have doctor referrals, but we have such a family-oriented practice that the patients are more than just patients. They're friends, they're family, and they treat us that way, and we treat them that way. It's a great symbiotic mutualism, if you will.
Oh, great. Well, given the fact that you've been in practice for a while, how have you seen the industry and treatment options evolve from when you started to now, especially when it comes to clear aligners and even digital tools?
So clear aligners have revolutionized orthodontics. Of course, years ago we had a twin bracket, and they're clear aligners. I was lucky. I trained at LSU School of Dentistry, an unbelievable orthodontic department, and Dr. Jack Sheridan was one of the pioneers on working with clear aligners. He invented the Essex retainer, which almost any orthodontic knows, and they spell it ESSIX, but it really is S to the 6th power, which stands for Sheraton Superior Stability for the Social 6. Very few people know that, but that's where the term Essex came from for Essex material. So we were using, even in our residency, we were doing some stuff with aligners, very primitive. We didn't have near the technology that we had today. So as an orthodontist, we were pretty much, you had to get on the aligner bandwagon at some point. We all know that there was one aligner company that they spent like $160 million on advertising, and they became synonymous with clear aligners. And it was a good product. That's about all we all had to use.
Yeah.
As it evolved, even, the mail order aligners came along. The purple boxes, if people come carrying in my office, they go, I bought this, but it doesn't work. What should I do? And my response was, well, do you have scissors at home? And they go, yeah, I got scissors. I go, do you cut your own hair? They go, no. I said, well, you shouldn't straighten your own teeth either. So along comes Spark. Spark comes along, I'm going to say 2021. The pandemic was going on. What did it bring to the table? A more clear aligner, a more comfortable aligner, and the main thing was a much more predictable result. What you saw on your ClinChecks checks and your approval was what you would see happening in the patient's mouth. You could literally go to that aligner, look in the mouth, and go, this is working, which was a beautiful thing. You didn't have that before. Okay. The support with Spark is unmatched. Ormco has done such a great job of putting together CE so that when you come on board, you're not floating around out there trying to figure out things for yourself. They've got the master court meeting. They bring in Yvonne and Diego from over in from Spain. I had to stop and think. And the master court meeting I've attended at least 3 times, because you always leave with more information and with some pearls that you didn't have before you went to those meetings. The support in your hometown. Kim Bromell is our rep with Ormco. She's amazing. If we have a question she doesn't have the answer to, she's going to have you that answer probably within 30 minutes. She's going to have somebody that can help you. Sheridan works with her. They're so good at getting us what we need when we need it if we have a problem. Let's fast forward to using it with the patients, the aligners. I've had patients that have had both competitor aligners and both Spark. They'll tell you there's no comparison. It's so much more comfortable. And I would say that the number of refinements that we have to do certainly has gone down, which means less chair time. Time is the commodity now. People just don't have enough time. They don't really, they love you, but they don't want to spend a lot of time in your office. They like to be given their Spark aligners and they'll go do their thing. It works great. Let me just say that. It's an unbelievable system.
Yeah. Well, so talk to me about how many cases do you think you've completed with Spark at this point?
Ooh, that, I've tried to put a number that well over 1,000.
Okay.
And that's my partner and I, we share patients. So it's not like there's a Dr. Robinson patient, a Dr. Caples patient. So we share patients and we get to see different things that we each do when we do set up our approval. And so we've treated a lot of cases. We're treating more and more. There was a time where you would have a day with 80 patients on the schedule. If you had 3 aligner cases, you go, "Ooh, I got 3 aligner. That's a lot." Yeah. Now I would say 50% probably of our day is aligner patients. I actually worked this morning, and I would say that probably I saw 46 people earlier today. Of those, 20 were aligner cases.
Okay. So then the workflow for you is good.
It's wonderful. And the fact that, so what really can go wrong with aligners? There's not a lot. The variable we have is the human element. I tell people you have to wear these things 22, 23 hours a day. It's like braces, but you have the luxury of taking them off to eat real fast and brush real fast and put them back in. They only work when they're in place. Yeah. I tell people, look, it's like dieting. I know when I wake up in the morning, this is what I'm supposed to eat. I get home at night and go, that's not what I ate. I didn't do good today on my diet. It's the same thing with the aligners. You know you're supposed to wear them 23 hours a day. If they get 20 hours a day in, you know what? It's still going to work out just fine. They may have to wear an aligner a little bit longer, but if you educate them, and the public is so smart these days as far as what's going on with what they're doing, that you don't have to babysit them very much. They get it. They know what they're supposed to do. And they also will be honest with you and say, you know what? I went on vacation. I was a little bit lax, so I wore this last tray a little longer. You know what? You pat them on the back and say you did the exact perfect thing. So it's almost foolproof.
I'm curious, is there any complicated cases that you've treated with Spark aligners that kind of stand out to you and kind of told you, okay, this is the right system for our practice?
So when you first get started, you say, okay, I'm going to treat an easy case, a little crowding or something like that. Then when you go to the master coip and you see what can be done with aligners, then you say, okay, I'm going to color outside the lines a little bit. So I've treated open bite cases with TADs and rubber bands over the aligners to intrude the posterior occlusion to close the bite. I've treated cases for protraction where you were trying to burn anchorage and move teeth back. You put in some TADs. You can still do it with aligners. Rubber bands with aligners. Just like with braces, you can have rubber bands to help fix your class 1, class 2, class 3s. And so the more you learn, the more versatile the product becomes for you. And you realize that you can do anything with aligners that you could do with braces. You just have to take time to get the knowledge. That was always my goal. I wanted to be able to look at a patient and say, did I treat them with braces or did I treat them with aligners, and not be able to tell the difference. And when that, and you know what? I can do that with Spark. I can't say I ever do that with the competitor.
Okay. Okay. Well, with so many aligner brands available, what makes Spark stand out for you compared to the other ones you've worked with and especially as you were making your decision to switch?
Well, and so one, the support,
Mm,
because you're going to have questions. You're doing it's a new product. You're going to have
yeah.
questions. The support was always 100%. It was
Yeah.
not like that with the others that we used. The
Okay.
support was very sketchy.
Mm,
Um, Kim is our rep. She's in our office at least once every 2 weeks,
hmm
and I can say that was certainly not the case with the competitor. As a matter of fact, I'm not sure the last time we saw the rep. So it just
Okay.
so support is the answer.
Yeah.
One of the answers. Two, the comfort and patient acceptance. They put the aligners in, and they go, "This is so comfortable. This is
Mm,
so clear," and they'll come back and go, "My friends didn't even know I had anything in my mouth," and
hmm
they're happy about that. Um, and then again, the results. That's what
Okay.
we're after. We want
Yeah.
a board quality result on every case we treat. Does it
hmm
happen? No. Any orthodontist that's done this long enough will tell you that you don't get a board quality, but it's usually not a failure of the product, and it's not a failure of the doctor. Patients are patients, people are people, and sometimes they just don't do exactly what you ask them to do. But so as far as the support and the result of the treatment after you get finished and the comfort of the patient throughout treatment are the three big selling points for us that made
Yeah.
Spark our choice.
Yeah. For you as the clinician and also for your staff, what about the Spark Approver software? How has that experience been?
It's been great, and they update it quite often. They're
hmm
constantly making it better and better.
hmm
And you have to spend a little time to catch up on the technology because they bring you these wonderful things, and you have to sit down and go, "Oh, I didn't know that was available." And again, that comes back to the support because they will come in and say, "You know what? We're going to spend 10 minutes, and we're going to show you this new addition to the software that is so much easier than it was before." And again, when you set the teeth, used to we would have to overcorrect a rotation or we would have to do a little extra to try to get it, squeeze it out of the product. Not with Spark. Once you set it and you look at it and you go, I like what I'm looking at, you hit accept, they send you the aligners. And when you get finished with whatever aligner, say they had 36 aligners, you get finished with that. What you see is exactly what you had on the screen 36 aligners ago when you started.
Yeah. I know that Ormco has rolled out new updates to the Spark Approver software and kind of the Spark platform overall with the aligner. Is there anything that stands out to you in like the last year or so since you onboarded Spark aligners that has stood out to you of like, oh yeah, I really needed this addition. Like this helps me.
It took a while to kind of learn even all the stuff that they came with at first, but how
Mm,
you could click stuff on, click stuff off. You could remove the
yeah.
attachments. You could put the attachments back on. They have a grid on the screen that you can actually measure everything and see how much expansion you're getting. And so to say that I know everything that you can do with that approval program is not true. But I do know that I have everything at my disposal that I
Mm,
need to treat the cases like I want to treat them. And
yeah.
when they do put out new software, they're very good about coming out and educating.
Yeah, okay. Well, I know that, Spark is one part of Ormco's product portfolio, and I know you also use the company's Ultima bracket system in your practice. How long have you been using Ultima, and how many cases have you completed there, do you think?
Oh, tens of thousands of those. So back when Dr. Chris came into practice around 2001,
hmm
self-ligating was coming on. So
hmm
a twin bracket is the same thing as the rotary phone that your grandmother had. You picked it up, you had to tie it
Yeah.
in. So the Damon Ultima is an iPhone 17. You got the
Mm-hmm.
world in your palm, and you just have to know how to use it. Our journey with that began. We were a beta test site for another major manufacturer,
Okay.
and we tried it, and we were trying Damon at the same time. The other manufacturer brought me in and said, Ricky, what do you think? What do you think about our product? And I said, start over. And they said, what? I said, yes, you need to start over. This product is not going to do well. It's hard to get the wires in the brackets. I've got patients in the chair that are very uncomfortable. and they have eventually, I think, abandoned that product. But anyway, we chose Damon. We went with Damon.
Yeah.
I can't tell you enough good things about it. We're on the Ultima now. We've gone through probably at least 2 or 3 upgrades, and I would be amiss if I didn't give a shout out to Dr. Dwight Damon. He's 8 feet tall. He's 50% heart and 50% brain.
Mm-hmm.
And if you go to the Damon forum, guess who you get to see? You get to see Dwight Damon.
Right.
I have no idea how old he is, but he's still in it, and he's changed the life and made orthodontics so much better for not only the practitioners, but mainly the patients. So you can imagine from a wire being pushed into a bracket and tied in and extreme discomfort to opening a door, putting the wire in, shutting the door. We're going to see you in 8 weeks, 10 weeks, not every 4 weeks. Mom's not having to take off work. You're not missing school. Your patient flow is better. And so the Damon system, the best in the world. Now let's fast forward to Ultima. What makes it different? So most bracket slots were always a square.
Mm-hmm.
And Dwight had his aha moment and started working with a parallelogram. And you don't really get it until they have these guys that are like brainiacs that come to the meeting, but they actually have this all in blocks and show you how it works. And when you look at it, you go, that makes so much sense. And it's exactly what you see in your clinic also. So when you're in there working with your patients, we grade ourselves. We look at our result and go, okay, are the roots parallel? What about the marginal ridge height, rotations, smile? We check everything. With the Damon Ultima system, you don't have to work overtime to get a board quality result every time.
So having that experience with the Ultima system, Damon system, Ultima system, being that long of a Ormco product user, what does it mean to you to have both your aligners and your bracket system from the same company, kind of that one-stop shop?
It is the best of both worlds. It's wonderful in the fact that we get the same support on our bracket systems as we get on our aligner systems.
Mm-hmm.
And again, you'd have to see what we had to deal with before you would respect and appreciate what we have now.
Yeah.
But it couldn't be better. It's so much nicer working with one company. And, literally, if I picked up the phone today, Kim would say, I'm going to call Joe or I'm going to call Alex. I'm going to call somebody and I'm going to get you an answer. Guess what? By 4 o'clock in the afternoon, you have an answer to whatever you're trying to deal with. So the support is great. Turnaround time, great. The fit of the aligners, great. So all the things that you have to worry about, you don't have to worry about anymore. They're there for you, and any support questions you have will be answered very quickly.
So before we wrap, for orthodontists who might feel hesitant about change, what would you tell them about the value of kind of staying open to new tools and approaches as the specialty evolves?
So Cammie is our youngest partner. She's been out about 4 years, and they actually got to do some aligner stuff while they were in their residency, which we did not. It was such an primitive stage.
Right.
But I would tell anyone that was hesitant to try Spark aligners to visit with their rep, call me. You're welcome in my office if you like. And there's so many guys across the United States that are amazing with Spark aligners that will share the story, because when you have something that works that good, it's almost like the gospel. You need to get it out there. You need to tell and share it.
Yeah. Well, Dr. Caples, thank you so much for taking the time to talk to me about your experience. I really appreciate it.
Well, and Allison, thank you for your time.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.